So after an office visit, the practice submits to the insurance company or Medicare what's called an E&M, Evaluation and Management Code. And that is either based on the time spent on taking care of the patient that day or on the complexity of the case. There's a set of codes for new patients and there's a set of codes for follow-up patients. For follow-up patients, we use the codes 99211 through 99215. If the billing is going to be based on time, 99211 is 5 minutes, 99212 is 10 minutes, 99213 is 15 minutes, 99214 is 25 minutes, and 99215 is 40 minutes. But we use those same codes in a different way if we are billing based on medical decision making. And there are 3 criteria that we look at to determine how complex a visit is. We look at how many diagnoses there are and how acute, how much of an emergency they are. We look at how much data needs to be reviewed and how many orders there are for tests and things like that. And we look at the risk of therapy. So if someone has one stable condition, one test is ordered, no medications, no procedures are done, then that is probably a 99213. If someone has 2 or 3 medical issues and a bunch of tests are done and medication is prescribed, then that could be a 99214. If someone has a chronic illness, but they're having either severe exacerbation, severe worsening, or they're having bad side effects from medication, and again, a bunch of tests are done, and the medication that is being used has a lot of risks, or if the patient needs to have surgery or something like that, then that is a 99215. Even if the physician spends less than 40 minutes with the patient, it may still be a 99215 because of the complexity of the case. Also, going back to time, the time doesn't start and end with the physician walking in and out of the room. Anything that the physician does prior to the visit on that day, let's say there's 20 pages of records to review before they go in, and then they have the visit, and then they have to document everything, and then they need to call the specialist to arrange things, or there's forms that need filling out. All that time counts. So even though the physician may not have spent 45 minutes with you, if they had to prep things and then call people and arrange for things, etc., and that took 45 minutes, then that is still also a 99215.